Glad to have you with us on Your Health. My name is Deborah Nimi Osman. On today's episode, we will be looking at the National Health Insurance Scheme, NHIS, with regards to the impact of private healthcare providers in the scheme. Also, we will focus on plan by the NHIS to include the informal sector, employers and employees in the scheme. But then, let's take this brief report.
A healthy population and a healthy workforce are indispensable tools for rapid social, economic, and sustainable development the world over. It is as a result of these words that the National Health Insurance Scheme (NHIS) was established to provide affordable healthcare services to Nigerians. Presently, civil and public servants who form the workforce in the formal sector have all been covered by the scheme. Every month they pay a token from their monthly earning to the Health Management Organization (HMO) as health coverage. However, the huge informal sector workforce have not been covered.
Why when they do test for me, sometimes they take my blood, everything, piece, everything go. They test me, go tell me say make I bring 10,000, abi 5,000. Sometimes I go give am, sometimes I no go get. I no fit get money give am. Why I go hospital, they say make I pay small small. I like am like that.
The last time I felt sick, I went to the AMAC. They charged me like, with the drug, the admission, everything. I think it's close to 7 to 8,000. I'm ready to contribute small money so that when I'm sick, I will be able to go to the hospital, go to the place, and they will treat me.
Sometimes 3,000 plus, sometimes 2,000 plus, sometimes 5,000 plus. I need government to register me with national health insurance thing. When I sick, I can go there to pay little money.
Even as the informal sector workforce look forward to be covered in the scheme, this will depend to a large extent on the services provided by the private healthcare practitioners, whose participation in the last decade have been tremendous because their services cut across both the poor and the rich.
The private sector, private medical practitioners are in every nook and cranny of this country, as ubiquitous as air. There's hardly any local government, in fact, ward in this country where we will not have a private medical practitioner. So the success of NHIS rests squarely on the shoulders of private medical practitioners of Nigeria. And we are willing and able cooperators to ensure this scheme succeeds. We, medical practitioners, are looking towards to ensure that the universal health coverage, every Nigerian, no matter where he or she lives in, no matter the socioeconomic status he or she is in, will not be discriminated against because of no money. We're looking forward to a situation whereby you walk into any hospital or clinic and be attended to with retaining your honor and dignity as a human person.
In scaling up to one of the objectives of the scheme, which is to boost private participation in healthcare delivery, this has been achieved with the payment capital to the private healthcare providers, who utilize this huge financial opportunity to re-energize infrastructural provision and services to patients in the hospital.
Because these monies, you can plan with it, because you have a definite amount of patients who are under that particular, scheme, the capitation scheme. You can actually, no matter how small it is, you can actually, make your budget, your plan for your, whether you want to provide yourself with facilities, pay salaries, or run, services and so on and so forth with it. Make purchases. So it has actually, it's somehow, it comes in handy, to some private practitioners. It actually goes a long way towards giving them that kind of, peaceful feeling that, of course, this one is always assured. Every month you can plan with it. Then every other thing now, you can actually get more depending on how well you do, or if the fee for services scheme also comes into play. So basically, it has improved services, have improved the morale and then the service base of these private practices.
For the scheme to take off, because it has been on, the idea of the scheme has been on for several decades until the Obasanjo era when it took off finally. We had to make do with the pocket of clientele that was readily available. That was the formal sector, and that was the federal civil servants. And the population of Nigeria is over 180 million, and federal civil servants are very few. Federal civil servants are less than 5 million. So you can see that it's just the tip of an iceberg. However, government is keen in ensuring that we have universal health coverage, whereby both the formal and informal sector, every Nigerian is keyed into this scheme.
As a result of this development, the scheme has recorded more than 9 million enrollees who now access healthcare services at various hospitals of their choice. To create more opportunities for private participation in the scheme, the NHIS is putting on new initiatives such as the Public Primary Pupils Social Health Insurance Program (PPP SHIP). This program aims to provide health coverage for about 24 million pupils of public primary and, more importantly, to make use of the facilities in the private hospitals, who will in turn make profit from the huge number of enrollees. Despite these successes recorded by the NHIS, the stakeholders believed that achieving universal healthcare coverage for all Nigerians is premised on providing health services to those in the informal sector.
Indeed, the private healthcare provider have played a great role in the success of the scheme, and we hope with the inclusion of the informal sector, more and better health services will be provided. Now, what are the plans for the informal sector and the poorest of the poor in Nigeria on healthcare service delivery? The Acting Executive Secretary will speak to us.
What has been the achievements of NHIS in the last decade?
10 years is a long time, and that actually is significant to us because this is 2015. National Health Insurance Scheme was actually started properly in the year 2005. The law that established it was actually promulgated in 1999, but we did not start the pilot run until 2005 with the formal sector program. And in the last 10 years, if you actually look at the activities of the scheme, you see that we've done so much, both in the formal sector area and also in the informal sector. And also we've been able to take care of some vulnerables and some poor people within the community. For the formal sector, we have so much success in that area because as at now, we have covered about 96% of the whole federal workers in the country, and that is actually a plus, though that is not the ultimate for the National Health Insurance Scheme, but that has actually shown the seriousness, and I'm sure based on the customer satisfaction surveys that we've done, a lot of people in the formal sector are pleased with this program. Also in the informal sector, we've been able to do a lot with some communities across the country. We've also done a lot under the MDG-MCH program, which is the Millennium Development Goal, Maternal and Child Health Program that we've been running, which we have successfully piloted in 14 states in the country in the last 10 years. And for the community-based health insurance program, we have different communities across the country where we have launched community-based health insurance programs in the north, in the south, in the southeast, in the southwest, and even in Abuja here. The latest one was in Lugbe community in Abuja, which we actually launched about a month ago. So in a nutshell, we've tried so much to be able to reach Nigerians through different programs that we have established over the last 10 years.
How has NHIS ensured the growth of infrastructure in the health sector?
Let me first make a clarification. The initial thing that was, when it was set up, the initial plan was for government to subsidize 10% and then workers were supposed to contribute 5%. But to date, there has not been any evidence of any worker contributing except the workers of National Health Insurance Scheme, because the Nigerian Labour Congress has not allowed any deduction from the salaries of the federal workers. So all what we have done in the last 10 years has been solely from the effort of the federal government of Nigeria, which I give them a lot of praises for. Now, in terms of infrastructural development, I'm sure if you can actually take some pain also to be able to go out to some of the healthcare facilities that have been accredited by NHIS, you will actually see the impact of this capitation that has been paid to them. We have a lot of facilities that have improved their infrastructure based on the capitation that has been paid to them. We have some of them that have equipped their hospital, because service delivery is also key, and they take it that once the hospitals have adequate drugs and other equipment that are needed, more customers will come. And you actually see that happening in a lot of these hospitals, which I can actually give you some examples. In addition to that also, you find out that we have so many of these hospitals cut across the private and the public. I want to encourage those that are in the private sector, because they actually depend a lot on this capitation that is being paid. For the government hospitals, they are being subsidized by government. Their workers are being paid by government. Some subsidies come also in terms of infrastructural development. But for the private sector, for those that are serious, you can actually see the impact it has made on their hospitals, because after paying off all the enrollees that come for treatment, the remaining amount of money is plowed back to development of the hospital. So we actually have a sizable number of people that have used these monies judiciously to improve infrastructures and amenities within their facilities.
Can private hospitals face bankruptcy as a result of inadequate enrollees?
That is one area that we are actually focusing on now at the National Health Insurance Scheme. Just like you have rightly mentioned, if you actually look at the private participation, especially in terms of healthcare provisions in Nigeria, you find out that there's not much encouragement for these people in the private sector to actually go into providing health services. One, banks are not ready to loan them money because they are not manufacturers, they are not selling things, and even the field to some of these financial institutions, because they don't understand the business in the health sector and they have not seen the business side of it, it's always difficult for them to advance money for private people to be able to take part actively in this sector. So for National Health Insurance Scheme, one of the things that we are trying to do now is to actually partner with some other agencies under the Federal Ministry of Health, that's on the supply side, to be able to create enabling environment for private people to be encouraged to own healthcare facilities and to be able to run it in a business manner. We are actually talking to a lot of these organizations whereby we will intervene, we will make facilities or loans available to them at single digits, which can actually encourage them. And the incentive for them is that once they register and they can take care of a local community or a primary healthcare domain, they will actually get enrollees. And from, like I said, from the capitations and fee for service that is going to be paid, they will be able to pay back whatever grant has been given unto them, and also to be able to make profit. So we need to intervene, and we are also begging the public also for private investors to actually see health also as a business opportunity, so that they can actually come in and encourage those that are in the private sector to be able to provide at least the basic minimum services across the country. And I'm sure that with these steps, they will not go bankrupt.
How has NHIS been able to regulate the private healthcare providers?
Well, first and foremost, the paramount thing to us in national health insurance are the enrollees. And capitation that is paid is for you to be able to absorb the costs of treatments that the enrollees have gone through. We do sporadic checks. We have a quarterly way of verifying payments that goes out from NHIS to the HMOs and invariably from HMOs to the healthcare providers. We pay the HMOs on a quarterly basis upfront, and they in turn pay the healthcare facilities on a monthly basis. So after each quarter, we send out a team of people to actually verify that these payments have been done. We always do this to make sure that service delivery does not fail on that other side, because once the facilities don't get money from the HMOs, there's bound to be service delivery failure. So we have a department which is standard and quality assurance and also enforcement that goes out to monitor these payments and to make sure that the monies are getting to the facilities. That is one of the ways by which we do it. Also, the role is on the HMOs because they get administrative fees for them to also go out for sporadic checks and give us a report on a quarterly basis.
What is NHIS doing to encourage private investors to invest in building more hospitals?
Let me take it from two sides. One, currently, like you said, we have about 9,000, between 9,000 and 10,000 facilities accredited by NHIS. That does not mean that it is 9,000 facilities in the country, totally. However, the National Health Insurance Scheme is trying so much to make it more inclusive, to actually relax the conditions that we have, to be able to take in a lot of other primary healthcare centers. The National Primary Healthcare Center Development Agency has about 21,000 primary healthcare centers across the country. And one of the things that we are trying to do is also to partner with them to be able to make use of these facilities for use for the health insurance scheme. So this will actually increase the numbers that we are talking about at the end of the day. And if you actually look also, encouraging the private sector is one of the things that I've mentioned before. So some of these primary healthcare centers that we're talking about will be given to private investors that are willing to run them like a business, and we will join hands to equip and to train their staff to be able to deliver health services. So we will try a lot to encourage the private investment, also to increase the spread of these hospitals. So if these primary healthcare centers can be reactivated, because a lot of them are dormant now, if a lot of them are reactivated, the service delivery will be spread across the country, and you find out that a lot of people that concentrate in cities will be contented with what they have even in their local domains.
What are the roles of banks and insurance companies in NHIS?
You know, it's a direct relation. People go to bank to borrow money. The insurer comes to insure the money that the bank will not lose their money. The reinsurer comes on top of it to ensure that the insurance company does not go bankrupt. It is actually a cycle, and we need also to be careful of this cycle, because at the end of the day, the reinsurer also comes back to somebody to make sure that he is also covered. But what we are saying is that if we are able to get some grants, which we have already identified that are available, and we can invariably pass it to these private investors at single digits, which does not put a strain on them, which does not require cutthroat collaterals for them to be able to get it, involvement of other parties will be reduced. We just need to be able to create third-party agents that can actually help these people to run these organizations like a business, so that they know that they can pay back the amount that they've gotten and be able to also make profit from it. So we will tidy all these things up. The banks are there to lend money, but we will use them as a tool to be able to, because we are not in the credit business, but if we have funds that are available, we will go through the banks for the banks to be able to lend it at a specified amount, which is going to be in the single digits, and we'll probably look for insurance company also to guarantee that these loans will not go bad.
What is NHIS plan to include the informal sector?
The informal sector actually holds about 70 to 75% of the populace of the country, and we have tried to sensitize the people in the rural area. One of the disadvantages of the informal sector is because of the unstructured way that they are. It is so difficult to get them together, and we are now trying so many other means, because if you go into this informal sector, you find out that a lot of them have associations and groups that already have a structure. And one of the things that we are trying to do now is to go through those associations and structure, and even community mutual associations that are already established, to be able to make it inclusive. So if we go into a town and they already have an improvement union or a mutual association of people of different age groups, we can actually take those age groups and propose an health insurance based on the need of that age group. You know definitely that the health needs of children is going to be different from the health needs of those that are adults. You know that the health needs of women are definitely different from the health needs of men. So if we can get these structured informal groups that are already established, we will probably use them to propel what we are talking about. One, it creates awareness, and then it creates confidence, because these associations are owned by these communities, and within themselves they already know how they are contributing money. They already know how they are giving out these monies for small and medium scale businesses for their people. It will not be difficult for them to earmark a percentage of it for health insurance for their members also. So those are strategies that we are putting on ground. We've been talking to a lot of these associations. We've been talking to a lot of these groups informally to bring them on board to the health insurance scheme.
Should government stop investing in public health care services?
One thing that is obvious is that the federal government cannot take care of the health needs of the whole populace of Nigeria. Though they are mandated by law to provide this service as in social responsibilities for the citizens, but health itself is not free. Somebody needs to pay for health insurance, and that is why National Health Insurance is actually preaching social inclusion in what we are talking about. Be your brother's keeper. And that is why the PPP, just like you said, will be a good avenue to make sure that these things work. It is only here in Africa that we have people that cater for extended families, for unknown relations, where everybody comes together, and somebody that can afford to pay can actually leave money for people that cannot afford to pay. If we're looking at the population, just like you said, 70 to 75% of people can actually be classified as vulnerable and poor, which means ability to pay is hindered. And that means that the remaining 25 to 30% must be able to cover up for this 70%. And that is the inclusion that we are talking about. So private sector involvement is something that is so welcome. A lot of companies in Nigeria now make so much money even from the citizens or from the inadequacies of the citizens or the system, and they should be able to plow back into this system. Government on its own part in the last 10 years has done magnanimously well, and that is why we are preaching that for those that can afford to pay for people, and for private investments that are ready to take care of healthcare needs of particular people, it is a welcome idea. That is the way to go. That is what social responsibility is all about. That is what health insurance is all about. To be able to pool a fund and also to pool the risk. Let people that can pay, let them pay. Those that cannot pay will be equalized from the payment that is already in the pool.
If these plans will go through, it means that by the year 2020, Nigeria would have met the health target of providing universal health coverage. And you can be part of this program by saving to save someone's life. This is all we can bring to you on this topic today. Join us again, same time, same station next week. Until then, remember, your health is in your hands. So let's stay healthy.